Thank you for joining Cancer Support Community Atlanta for this installment of the Tell Me More series. This program focuses on obesity and cancer and is facilitated by Dr. Sujata Gill with Bariatric Innovations. For other installments of the Tell Me More series, please visit cscatlanta.org.
Hi, my name is Sujata Gill, and I work for Bariatric Innovations at Northside Hospital, Forsyth. And today, I just want to talk to you a little bit about weight loss resources that we have for cancer patients here at Northside. Just to give you a little bit about my background, I have been with Northside Hospital Forsyth for several years, but I'm bariatric and general surgery trained and robotics certified. I started my training back in DC and Georgetown in 2009, went to Emory Hospital for my fellowship in kind of all the things I do now in 2014, and then had started practicing in the North Georgia area since 2015. So I just wanted to start off by just talking about what is obesity. We all probably feel like we have a few pounds to lose, but in a medical sense, we do have a definition for what it is to be obese. We talk about this in terms of your BMI, and we use your height and your weight to calculate this. Now, I will say there are people who are bodybuilders out there, and their BMI may not be reflective of obesity because they carry their weight and muscle in a very different way. So we do obviously take into account somebody's body habitus. But we do define it as a chronic disease, and we consider it to be caused by a lot of different factors, environmental, genetics, and not always just the food that we eat. So how do we define what morbid obesity is? We tend to classify that as someone with a BMI of at least 35, and they have some kind of health condition that we can attribute to having the weight that they have, or if they have a BMI of 40 or higher. Anyone that's over a BMI of 50, we classify that as more of a super morbid obesity. And I get this question a lot, is there a maximum weight to have therapy? Well, sometimes we do need you to lose weight if you're specifically needing to have equipment to help you. And that could be even as simple as finding a scale that will let us weigh you, or even imaging capabilities sometimes. And so what are comorbidities that are related to being overweight? I think a lot of us probably know the obvious ones like diabetes and high blood pressure, but there's a lot of other ones: sleep apnea, fatty liver disease, and cancer. You see that big, bold, and bright and kind of near the top. Even the CDC, the National Institutes of Health, they've all defined cancer as related to obesity and not just morbid obesity. And when you talk about kind of rising trends of obesity in America, and I know I'm not a cancer doctor, but I know cancer doctors often talk about how cancers are rising trends in America as well. And so I do love the visual graph of just, the changing colors. We can apply that to lots of different health conditions, and we all know that as we go along the years, we see more and more of diseases and obesity and cancers coming up in our populations. And I'll just pause for a minute and talk a little bit about the obesity risk in relation to cancer. And, talking to some of the cancer docs that I work with closely, they've kind of educated me on the fact that sometimes, it's not just women's health, it can be men's health as well. But patients often, if they are obese, may not want to come in for screening. And so they may have a delayed diagnosis of their cancer because they just felt too vulnerable in their state to come in and get screenings that perhaps non-obese patients are more likely to get. There's also an association with hormones. We think about risk reduction for cancer care, and then also for prevention of recurrent cancer if you've already been cured of cancer. And it could be esophageal cancer, gastric cancer, pancreatic cancer, endometrial cancer, liver cancer, colon rectal cancer. Obesity creates inflammation, and we know that inflammation can cause abnormal insulin regulation. It can affect your immune system regulation. And so there's just a lot of mechanisms of how obesity and cancer interact with each other. I'm here to kind of just give you an overview of weight loss. I think every individual probably has some aspect of a weight loss journey that they go through, especially as we get older, and we do maybe take more attention to our health. And I always tell people, all we're doing is giving you a tool. If we provide you a hammer, you got to build something with it. But no matter what tool you decide to use, or you might pick multiple tools, it really is the efforts, and it is mostly daily, consistent efforts that get people to where they want to go to see some kind of outcome or result. I always tell my patients that it really doesn't matter the tool that you pick. It just has to be something that you're going to use. And you might have to try a bunch of tools to find the right one, or a tool might work for a while, and then you might have to find a different one. And so we often combine them. But the important thing is just that daily, consistent commitment. My successful patients, no matter what tool they use, really are the people that speak positively about how hard it is and waking up every day and having to first thought of the day be like, how am I going to move today? How am I going to get my water? How am I going to get my protein? And I always tell people it may be you took a few extra steps today than you did the day before, but just a little bit of movement every day goes a long way versus thinking, I'll just do that on Wednesday. And then Wednesday comes and you might have forgotten. So just thinking about things daily and making small changes that have a big impact is really kind of what we find most successful, because you can't sustain something that you can't commit to within the routine that's personal to you. And so everyone wants to know, is it really necessary to watch commercials? And it seems like, gosh, if you just take this medication or get this surgery or do that diet, you could just suddenly lose weight. And we have not found that magic pill, and that's an upcoming slide. And so, yes, lifestyle changes are necessary. And I think this is a really good visual of, kind of using the tool like we talked about and making good lifestyle changes that are doable for you to keep up with is really the success over time, and it does take time to hit that success. And so I'll also mention the medications. And I always tell my patients, there are so many options. We right now all know about GLPs, and there's lots of good resources and good prescribers out there for them. But before GLPs, there were a lot of medical weight loss doctors that had other tools that were utilized for decades. And so it really is kind of talking to somebody, and we obviously have a full medical weight loss program that can help, that gives you the options that might be right for you. And it's knowing kind of what might be the best for your situation and also might not have the side effects for your situation as well. I think too, that's paired with the lifestyle changes for it to be successful instead of just, taking a tool without making any of those changes. But like I said, there's no magic pill. And just like there's no magic pill, there's no magic surgery. Although we do also have a surgical weight loss program. And I'll touch a little bit on that. Our surgical weight loss program really works with every other aspect of care that you might need. Surgery is just meant to be safe as a tool, but it does involve all the other parts that really need you to be safe and successful with it. So, the first question I always get is, does my insurance cover it? And, patients need to know that about their medical weight loss coverage too. And so we have patient advocates that kind of help answer those questions. What is covered, and how do you obtain coverage, or, what are the costs might look like associated with something that you might want to do. We also have a bariatric nursing help navigate people through the programs and pivot from one to the other. We do involve behavioral health coaches. We have a TrueMed program that's also another coaching program, but we really believe in positive coaching. This is not easy to do alone, and it could be counseling, it could be a psychologist, it could be a psychiatrist, but just some person or program that can help you with coping, because that's life. Life is stressful. And we got to be able to cope in a healthy way, regardless of surgery or medical weight loss. I think that's important. We also have registered dietitians, and they are bariatric, but they also know about any kind of dietary needs. And, obviously we have patients that might have kidney disease, might have diabetes, not just cancer or obesity. And they are well versed in making sure that the diet plan that they come up with you is safe for your body as a whole, and not just, weight loss in its isolated nature. We also use our aquatherapy program a lot at Northside Forsyth. There's also a pool program up at Cherokee, but I think pool therapy is something that helps a lot of our patients, because you want to move and you want to move safely, and joint issues can come along with obesity. And what we don't want you to do is move and have an injury or worsen a problem when we're trying to help you not have that problem by losing weight and moving. And so sometimes our aquatherapy program is really successful in getting patients to understand how to move and how to move safely. And it is one-on-one and very successful with our patients. I think, there's free resources too. A lot of people use the free pools in the area because pool therapy and pool water aerobics can just be, like I said, gentle for patients in movement and on their joints. Again, we have a medical weight loss specialist, and a lot of people do pair a lot of the different options together to kind of figure out their right fit and what might work best for them. And then, of course, we have bariatric surgeons throughout Northside as well. And so people always want to know, well, how do I know if I need surgery? Well, you want to qualify for surgery. And I do tell people sometimes you're too skinny for surgery, and that's not a bad thing. And typically, it's our patients with a BMI of 30 or higher with a significant comorbidity, depending on their insurance coverage through the National Institute of Health, or it's a patient with a BMI of over 40 or over 35 with a health-related obesity disease, like we talked about before. And the goals of weight loss surgery are the same as the goals of medical weight loss therapy or a dietitian-based weight loss program. It's just trying to obtain a durable weight loss, improve your health, and enhance your quality of life. And I do tell patients that, improving your comorbidities doesn't mean that we always eliminate them, but certainly weight loss helps your health, and that helps your medical care team take better care of you and hopefully improve a lot of those comorbidities with the ways that they're treating them. And then I always tell people part of the goal of it is not always on the scale. There's so many health benefits with weight loss, and we call those non-scale wins, and we celebrate them. Maybe you change the clothing size. Maybe you feel more energetic. Maybe you just feel like you can walk up a flight of stairs easier. But my favorite one is people that just kind of feel better about themselves, like getting self-esteem and feeling confident in yourself and feeling good about yourself. That's probably the best non-scale win that we achieve with weight loss. And this is just an overview of a lot of the common surgical procedures. I will say that the sleeve gastrectomy is probably the most popular and lowest risk operation. And so that tends to be the majority of our practice. And there's lots of good evidence-based recommendations that a sleeve can be a low risk operation, but a very successful long-term for patients. And we do all of our surgeries robotically. And so that's, a pretty kind of overnight, easy stay in the hospital to go home with hopefully being part of the 100-pound club, getting early improvement in your diabetes, your high blood pressure, your low back pain. We have a lot of patients that go on to have successful knee and hip procedures if they need them. A lot of those non-scale wins, like we talked about. I do think that, things that we used to think were contraindications or we couldn't do sleeves for, we've overcome those myths, and we've really seen that they are not true contraindications, and people do just fine with a sleeve in most clinical scenarios. And a lot of what's on this slide, I always say, this could be the same with a diet program, with a medical weight loss program. The outcomes should all look the same if you're successful in weight loss, no matter how you achieved it and with what tool you did so. I borrowed this slide from my medical weight loss colleague because she talks about 5 pillars of weight management. The first being healthy nutrition, the second being movement, the third being behaviors, medications, and surgery, of course, can always help with those first 3. Movement is really important. What you choose to eat or what you choose not to eat is really important. And then I do think, how we change behaviors with food, which medications can sometimes help. Certain folks that might have what we call food noise, or some people do need surgery to help with kind of their absorption difference or the amount of food their stomach can hold. Really can be something that is your best investment if you're looking for a weight loss journey that you would like to be successful long term. Well, thank you for your time and attention. I'll leave with just a few closing thoughts. And one would be that the oncology program at Northside has a really robust dietitian program, and that would be a great place for cancer patients that are interested in weight loss to at least have a place to begin their journey. Certainly call us for more information if we can be of help with any of the services that we provide or answer any questions. I will mention also, if you've already had bariatric surgery and now find yourself in the cancer care need as well, but don't know how to get a practice that is willing to help you post bariatric surgery, and perhaps your program doesn't exist or you don't live near them anymore, here at Northside Bariatrics, we are happy to have you as our assumed care and help your journey even with your bariatric surgery in place and your cancer care ongoing. Thank you again, and we hope to hear from you.
Thank you for joining Cancer Support Community Atlanta for this program. If you're interested in other live or recorded programs, please visit the online program tab of our website, cscatlanta.org, or follow us on Facebook. We'll be sharing additional information on upcoming programs.